There is this aura, this calming effect, this presence when they walk into a room and you literally say, thank God for people like that. Because if it was left up to people like me, kids would just be deaf.
Yeah, it is tough. Yeah.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Welcome back to another special Labor Day episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Jordan.
And by special, I mean it's the exact same thing that we normally do, but it happens to be coming out on Labor Day. And so we are going to honor Labor Day by working for 10 minutes in front of microphones and a camera, blood, sweat, and tears coming in hot.
Yep.
That is how we acknowledge everybody else who actually works really hard for their job. All right, today's topic, and this is something Dr. Jordan is an expert on. She was telling me about it off camera. This is her number one topic that she loves to discuss. We're going to talk about the differences when it comes to treating pediatric patients and elderly patients. And I have stopped myself from writing jokes about this. The only joke that I will say is chances are they're both getting rights to their appointment. Other than that, that's where I'm stopping. I'm stopping right there. Nobody cue any drums, okay? That's it. There are no more jokes coming. So now I feel like this is probably an easy topic for most people to fill in the gaps on. But just because there's an age difference doesn't necessarily mean everything surrounding the patient is different. Mm-hmm. But Dr. Jordan, you can kind of take this in whatever angle, avenue you want, and we can start super high level and drill down from there.
Sure.
But in your vast experience, what are some of the major differences when it comes to treating child patients as opposed to elderly patients?
Yeah. I mean, first it starts with testing, diagnostics.
Yeah.
I mean, obviously that's going to look a little bit different between the two.
And I imagine that actual process, depending on the age of the child, is far easier said than done.
Yes, absolutely.
I have seen it a few times, and watching a child who truly doesn't understand what is happening get a hearing exam, you would think that they're taking them to the gallows.
Yes.
That this is their last day on earth and they're never going to see their parents again. And all they're doing is putting some tubing into their ears. So that in and of itself is probably one of the major differences, I would imagine.
Yeah. I mean, just from the very jump of testing a kid and putting that otoscope, the light in their ear, there's a lot of times that's just a meltdown from the start.
So here's my first question. Now that we've talked about this, when it comes to these patients, there's like a bedside manner, right?
Yeah.
I imagine the bedside manner, or at least ingratiating yourself to a younger patient, is like 5 times as long.
Yes.
Because it's all about trust in that moment.
Yeah. You got to bring all the energy.
Yeah, totally. It's like, I'm positive, I'm upbeat, I'm one purple suit away from being Barney.
Yes.
Like, you can trust me, I promise you.
You're bringing in all the toys, the bubbles, the stickers. You're pulling out all the stops. You're doing whatever you got to do to get each part of the test done. Yeah. I mean, obviously, the testing is very different between the two. With kids, you're going to get as much as you can get, and you're basically going to live with that. And you're, even if that means bringing them back after multiple appointments to get a full test. I mean,
so is there like is there a baseline where you're like, hey, if we're like within 5% of what actually is happening for a kid, we're good?
Yeah.
Okay.
Because with kids, you're typically testing a lot more frequently than what you would with an elderly patient.
Sure.
So it gives you a little bit more confidence of like, okay, if we don't get this today, we're going to retest very soon.
Okay.
And, we'll hash out those very minute details. But, it is so important because with a kid, I mean, they are a sponge. We're relying on them, that they're still in such a learning stage of their life, that we also want to make sure that we're not sacrificing any hearing on that part, so that they have the opportunity to learn, just like their other hearing peers.
Absolutely. And so then if we go to the other side of it, it's not like simply because they have wisdom, they're any easier to deal with. Oftentimes, I imagine when an elderly patient comes in, sometimes it's begrudgingly
Yes.
or being literally drug in.
Yes.
So the bedside manner there is less about
Yeah.
making sure that they're not going to kill you and more about you can trust me, you're going to walk out of here
Correct.
feeling better.
Correct. Yeah. Yeah. So, with our elderly patients, you do have to do a little bit more hand-holding, a little bit more caring and understanding, and just kind of getting to a level to where they can trust you and that you understand what they're going through and that they understand that, okay, she hears me.
Yeah.
I feel like for most of us, and especially for elderly patients who, let's, be real, they stay in a doctor's office for the most part. They go to frequent doctor's appointments. They're not always heard.
Yeah.
You go into all these different appointments and you walk in, the doctor comes in, they tell you, whatever it is that you need. They tell you what they want to tell you and they're out of the room.
Yeah.
Whereas when you come in for a hearing test, oftentimes we're actually sitting there just listening.
That's a great point.
Quite a bit.
Yep.
So it's two very different appointments. With kids, yes, you're having to entertain the kids and that kind of thing, but there's also a different aspect when you're bringing in the parent into that too. It's a very different conversation of talking with the kid to the parent to the elderly patient.
You're right. There's almost like a chorus that's happening.
Yeah.
Everything you're saying to the kid, you're then saying in more adult terms to the parent, and then more often than not, you can have that one-on-one, but that one-on-one is typically a little longer because some of your elderly patients are looking for that connection, are looking to be heard, to be like, I've been coming in here for so long. I know something's wrong. I know something's up. And rather than just treating them like a number, you're treating them like a person.
Yeah, absolutely.
Are there diagnoses that clearly are more common in children than in adults or vice versa?
Yeah. So it's a good point. So with kids, most of the time when I'm testing just I'm going to say like an everyday kid that would come in, meaning like we get a referral from, let's say like an ear, nose, and throat doctor or a pediatrician to where, hey, we have some concerns maybe about their hearing, they've got speech delay, or they've had reoccurring ear infections.
Sure.
Then for those kids, they're coming in, we're just looking to see, do they have wax in their ears? Do they still have an ear infection? They've been through a couple rounds of antibiotics. What are we dealing with? Do they still have fluid? That type of thing. So most of the kids that are coming into the office, it's to deal with what's called outer or middle ear problems, which result in more of a conductive hearing loss. Whereas for our elderly patients, most of the time, not always, but most of the time, we're not dealing with fluid at that point.
Sure.
We're dealing with hearing loss that has been a gradual hearing loss that's been coming on, year after year after year. That's just been progressive, and it's what's called a sensory neural hearing loss, which is more of like a inner ear nerve related type of hearing loss.
Sure.
It's more of a permanent hearing loss.
Yeah.
With kids, it's more temporary stuff. Adults, it's more permanent.
So here's where I just want to really put you on the hot seat. Okay. This is for everybody in post-production. Dim the lights, put a spotlight over Jordan.
Oh no.
Very Who Wants to Be a Millionaire without any
Phone a friend?
Yeah. You can. Without any of the questions. In your experience as an audiologist, Dr. Jordan, if you had to pick one, what group would you treat for the remainder of your time as an audiologist?
For me personally,
We're going to alienate all the 12-year-old listeners of Ask an Audiologist.
So sorry, but it would absolutely hands down have to be my elderly patients.
Got it.
I love treating my elderly patients. That is my soft spot. I do like seeing our kid patients that come in and the children, and it's a fun break, and you got to bring in all the energy, but for me personally, it is so much
because you're getting to talk to an adult.
Yes.
It's more of a peer thing.
Yeah.
I get that.
Yeah.
I mean, having been in this space for so long and having been into clinics and gone on philanthropic trips, the kid thing, I would say, and I think you'll agree with me.
Yeah.
The kid treating kids is like, the payout is super rewarding, right? It's when a kid gets to hear for the first time, or they have earwax removed, or any type of pain, you feel like you've contributed to society, right?
Absolutely.
But the lows in dealing with a kid can be pretty low as well.
Yes.
There's a nice middle ground.
Yeah.
With adults, and I think that's where you're speaking
There's a lot
to.
more consistency that's in there. Yeah, for sure. I mean, I definitely think that it is it takes a particular person, a particular audiologist to just be that pediatric audiologist.
And I've seen them, and they are saints on earth.
Oh yeah,
They
absolutely.
are,
And you can pick them out
totally.
instantly. You know,
There
you
is
can
this
tell.
aura, this calming effect,
Yes.
this presence when they walk into a room, and you literally say, "Thank God for people like that."
Yes,
Because if it was left up to
absolutely.
people like me, kids would just be deaf.
Yeah, it is tough. Yeah.
Well, to find out more information about hearing loss and as it relates to you and your age demographic, feel free to head on over to askanaudiologist.com. And Dr. Jordan, for this being your most favorite subject, you knocked it out of the park.
Well, thank you. I appreciate that.
Of course, we'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.